Welcome to this training video on measured blood loss at St Michael's Hospital. It is well known from research that estimated blood loss post-delivery by visualizing bloodstained materials can be inaccurate. For this reason, as you will now know, St Michael's has recently switched to actual measured blood loss. The reason for switching to measured blood loss is to allow earlier detection and intervention in postpartum hemorrhage. Measurement of blood loss helps to reduce the chance of a small bleed turning into a severe or life-threatening PPH. Following approval by the CDS Working Party, measured blood loss has now been implemented since the 1st of November and should be used for all deliveries going forward. Measured blood loss should be used from the point of delivery for all births on MLU, CDS or in theatre at St Michael's. For home births, it is not practical to implement measured blood loss 100% of the time, but measured blood loss should be started if possible when blood loss is ongoing and likely to exceed 500 mL. This video will now discuss how measured blood loss can be achieved in practice. Laminated sheets with a table of all materials used and their weights are available on the walls throughout MLU, CDS and theatres. The laminated sheets can be used to record the measurements for any individual woman before being wiped clean for the next patient. The final measured blood loss should be recorded in the partogram instead of estimated blood loss. It is absolutely essential that Lycor is not included in any measurements. Any Lycor stained incos should be removed immediately after delivery before any blood loss occurs, and a fresh inco should be placed under the patient so that only blood is measured going forwards. Once the inco pad has been replaced, then measured blood loss can begin. In order to measure blood loss as accurately as possible in real time, all blood-soaked materials should be weighed as you go along. Weighing of materials includes all blood-soaked swabs, but also anything else that is blood-soaked, such as incos, blankets, towels, gowns, and under-buttock drapes. Remember that 1 ml of blood weighs 1 gram when being measured using the weighing scales. As an example, if an inco is used and became blood-soaked, then its dry weight and wet weight can be recorded in the corresponding boxes on the laminated sheets on the wall. Do not forget to multiply the dry weight by the quantity of incos. For example, the dry weight of 1 inco would be 45 grams, but the dry weight of 2 incos would be 90 grams. At the end, total dry weight and measured wet weight for all the materials used can be added together at the bottom of the laminated sheet. To calculate the blood loss, simply subtract the total dry weight from the total wet weight. This calculation is written at the bottom of the laminated sheets found on the walls throughout CDS and theatres. This can be calculated to get the overall measured blood loss at the end of a case. For instance, if the total blood-soaked wet weight is 140 grams, then subtracting the total dry weight of 40 grams to get the measured blood loss, in this case would give a blood loss of 100 mL. Under-buttock drapes should also be weighed. During blood loss, particularly in theatre, it is important that other fluids such as wash and Lycor are taken into account. In the future, we are aiming to start using graduated under-buttock drapes with a measurement scale to make this easier. When this is available, this method can be used by noting the volume of irrigation wash or Lycor in the under-buttock drape before any blood loss occurs. This means that any fluid after the placenta is delivered is then counted as blood loss. For example, 750 mils of fluid loss minus 250 mils of irrigation loss would give a blood loss of 500 mils in the underbuttock drape. The same method should be used for measuring blood sucked up into the surgical suction in theatre. This ensures that other fluids, for example amniotic fluid or irrigation wash, once again are subtracted from the running total. In addition to measure blood loss, there will soon be a new 4-page postpartum hemorrhage performer with escalating stages that allows better response to increasing measured blood loss and postpartum hemorrhage. This will hopefully be available from February 2022. Thank you for listening. If you have any further questions, please get in touch with either Elena Howes or Emma O'Hagan, who will be able to help you.